pinpoint pupils, agno respirations, dozens of needles next to them. This is what a common scene of an overdose looks like. This speech is about overdoses and what can be done to help prevent and fight against overdoses. I've been an EMT in Springfield for 3 years, and I am now a firefighter in Springfield, Mass. I've administered Narcan more times than I can remember, and I've had countless overdose response calls. It's a common saying that 1 year experience in Springfield is equivalent to 3 years in any other city due to the amount of calls responded and the nature of the calls. Overdoses are becoming more prevalent and more common in everyday life. Knowing this information could be beneficial to you if you ever come across a loved one or a stranger that could be experiencing an overdose. In this speech, I'll be providing background knowledge about overdoses and some ideas that can be implemented to help reduce overdoses. So now we're going to start off about what exactly an overdose is. So let's discuss some background information about overdoses. What exactly is an overdose and what does it look like? A drug overdose occurs when someone takes too much of a substance their body isn't used to and it gets overwhelmed. An overdose can occur when you take too much of a prescribed or non-prescribed medicine, alcohol, and many different substances. And this is per Better Health, the website. An overdose can also occur if you take a drug that is laced with something that you aren't intended on taking. So what does an overdose look like? An overdose can look like a bunch of different things, but today we're going to focus on opiate overdose. So an opiate overdose has prominent symptoms. There are pinpoint pupils, someone's having agonal breathing, and if they're unresponsive or they have minimal response to different stimuli, like a painful stimuli or a verbal stimuli. If they're vomiting, they have nausea, diarrhea, chest pain, dizziness, and much more. There's a list of symptoms on Better Health website. Any other overdose could have similar symptoms to an opiate overdose, excluding the pinpoint pupils. One way to determine what type of overdose is occurring is best to ask bystanders or someone who knows the patient if they know what drugs or substance was taken. Overdoses can be prevented and are avoidable. If you can't prevent it, there is a solution to it before the issue becomes much larger. So what can be done in the event of an overdose? When you come across someone who has the symptoms that were listed above, you can confirm it's an opiate overdose. You can administer naloxone, which is otherwise known as Narcan. If you do not have access to naloxone, the first thing you should do is call 911 and try to gather information about the person to provide to the first responders. So what can be done to prevent an overdose? There are many ways to avoid an overdose. Firstly, it would be to abstain from using drugs that could cause an overdose or abstain from an excessive amount of a substance. Another way to prevent an overdose is to ensure that the right drug is being taken and that it isn't laced with anything. So a drug overdose is when the body reacts to too much of a substance and the body gets overwhelmed. We can recognize it by looking at the person's pupils, their surroundings, their breathing, some other bodily symptoms that they are experiencing. We can treat it by providing Narcan and obtaining as much information as possible. So now that we have some background information about overdoses, let's discuss what can be done to help prevent them from leading to fatalities. Overdoses can be prevented, and if they can't be prevented, they can be fought faster to avoid fatalities. So we're going to be discussing the benefits of educating the public about overdoses, the benefit of making naloxone or Narcan more accessible for the public, and educate potential users on how to recognize laced drugs. So, firstly, educating the public on overdoses would be beneficial. We can educate the public by providing easily accessible information or forums on overdoses and methods on recognizing overdoses. We can provide lessons on how to administer Narcan. We can provide lessons on what steps to follow if you think someone is having an overdose as well. We can educate the public by making statistics of overdoses and overdose deaths in their community more public and more vocal. Making naloxone, aka Narcan, more accessible help reduce fatalities from overdoses. So by providing easily accessible naloxone stations with clear instructions on how to administer the Narcan and following the steps after administration, it could help decrease the amount of deaths. A case study was done in Connecticut regarding how to reduce deaths as a result of opiate use, and it states that maximizing public access to intranasal Narcan decreases overdose deaths by 20%. And the author's name is Scheidel. I will link the articles that I used in the description. By providing education and the necessary resources, people are going to feel more confident in providing treatment and recognizing potential overdoses. Educating users about the possibility of receiving a laced drug or how to recognize a laced drug could reduce the fatalities from overdoses. An article published regarding strategies on how to recognize and reduce fentanyl intake provides numerous methods, such as doing the drug with other people around to help combat death if an overdose were to occur. And that's from another article with the author Walters. That same article recognizes how to reduce fentanyl intake, suggests inspecting the drug thoroughly for any miscolorations, and also use fentanyl test strips to inspect if the drug is faulty. Once again, the author's name is Walters. So educating the public on overdoses would be beneficial in preventing fatalities from overdoses, along with providing more accessible Narcan stations. Educating users on how to recognize and reduce fatality intake would decrease the fatality level as well. So now that we've discussed how overdoses can be prevented, and if not prevented, fought faster, I'm going to summarize everything I just said. And drug overdose is when the body reacts to too much of a substance and the body gets overwhelmed. We can recognize it by looking at a person's pupils, their surroundings, their breathing, and some other bodily symptoms that they are experiencing. We can treat it by providing Narcan and obtaining as much information as possible. Educating the public on overdoses would be beneficial in preventing fatalities from overdoses, along with providing more accessible Narcan stations. Educating users on how to recognize and reduce fentanyl intake would decrease the fatality level as well. The information you learned today was the very tip of the iceberg. I would suggest everyone to go out and learn as much information as possible, because you could one day use it to save a loved one or a random stranger. Remember, every life is worth saving. Thank you.